All right, hello everyone. Today is July 25th, 2024, and today I'm going to show you how to cannulate the AVF. So first things first, we're going to start with their hand hygiene. So I'm going to put my EpiCleanse onto my hands here. And then I'm going to go ahead and put my gloves on. And I'm assuming that the patient already wiped the access line with soap and water. But if they have not done that, then I will do that for them. I would have already done that for them. But we're going to assume that in this case, they already washed the area with soap and water. So what I'm going to go ahead and do is inspect our access line. Before I do that, I'm going to go ahead and clean my stethoscope using an alcohol pad. Okay. Put that in the trash there, and then I'm going to go ahead and inspect the access line. So what my goal is I'm going to hear for a whooshing noise. So I'm just going to go ahead and go along the line here and hear for a whooshing noise. And we're assuming that we have heard the whooshing noise, and we're going to feel the thrill along the line. But if there are any signs of pain, infection, if we heard a high-pitched noise, then I would notify the licensed nurse before continuing on with the procedure. So the first needle that we're going to inject is this arterial needle. This has a red clamp. We have our safety clamp. And this has a back eye. So this is going to differentiate the needles that you're working with. So if you have a back eye, then that means you're dealing with the arterial needle. So we're going to recap that real quick. And before we start, so this is the hand, this is the elbow. I'm going to assume that in this case, I'm assuming that the blood is flowing towards the elbow. So I'm going to inject this arterial needle retrograde, which means we're going to inject it in the opposite direction. And so in order for this to make it easier, I'm going to go ahead and wrap the elbow using a tourniquet here. We don't want to do it so tight. We're going to do it tight enough so that we can feel the access line, and we can also, it'll be easier for us to see where we're injecting. So I'm going to go ahead and rotate the prosthetic arm. So I'm not going to be injecting it towards the elbow, but towards the hand, the opposite direction. So I'm just going to go ahead and rotate it so it's a little bit easier for me to work with. And I'm going to go ahead and clean the area using an alcohol pad. Let me see if we have extra alcohol pads in here. We'll just, for the next one, we'll just use this one here. Okay, so now we've cleaned the area. We'll let it air dry for a little bit. While it's air drying, we'll go ahead and get our tape ready here. Just so that it's a little easier, you know, when we're putting the needle in, we don't have to multitask because we want to make sure that we do this when we're all ready. So we're going to put our arterial needle in first, uncap it, and we're going to inject this at a 25-degree angle. And as you're injecting it, you're going to feel resistance, so like a flash. So you're going to tape the wings down. Perfect. Once you tape that down, then you're going to go ahead and get your gauze here. You're going to tape it towards the top of the gauze, and then you're going to put it right there. You're going to rotate your tape. Make sure you tape down the needle. That's the whole purpose of doing this taping here. Okay. Perfect. So once you've taped that down, I'm going to go ahead and put a little bit more on the side there to make sure that's really on there. Perfect. Then you're going to go ahead and tape the tube down. It's very important to make sure you tape the tube down. We're going to get ourselves a pretty good size tape here. And you want to make sure that you lift your tube up like this. You're going to put the tape in the middle. You want to make sure that the sticky side's up. And you want to make sure tape that tube down just like that. And then you're going to do the butterfly technique. So you're just going to tape upwards like that. Do the same thing with the other one here. Hold it like this. And now this should be stuck on there. So in a real patient, you would not lift this up to make sure that that's on there. Now, clearly it's on there, but this is just for practice purposes. So that means, you know, it's stuck in there, which is good. So that's the arterial needle. So now we're gonna go ahead and do the venous needle. So you can tell because this has the blue clamp and we have our safety clamp there. And then when you open the needle here, you see that there is no back eye. So that's gonna tell us that we're dealing with the venous needle. So forgot to mention that the arterial needle is taking the blood away from the body towards the dialyzer machine. So now in this case, we're dealing with the venous needle, so it's taking the blood towards the body, the good blood towards the body. So that we're gonna go ahead and do this antegrade, so towards the direction of blood flow. And because the blood is flowing towards the elbow here, we're just gonna go ahead and rotate the prosthetic arm, so that's a little bit easier to inject the venous needle. Okay, so again, before we start, we're gonna go ahead and clean the area with the alcohol pad, just like so. Okay, clean the area, and we're gonna let it air dry. And while it's air drying, we're gonna go ahead and get our tape ready. So get our tape ready, put it onto here. All right, perfect. And then now once you do that, then should be fully air dried now. You're gonna get your venous needle and you're gonna do the same process. So you're gonna go ahead and inject this at a 25-degree angle once again, so just like so. And you're gonna feel like a flash. So like you're gonna feel a flash, feel some resistance. You're gonna get your tape you got earlier, that's ready. You're gonna tape down the wings, and then you're gonna take your gauze here, and you're gonna go ahead, oop, I don't want that to rotate there. Then you wanna go ahead and take your gauze, take the tape you got ready, put that near the top, the gauze there, and you wanna go ahead and basically tape down the needle that's on there. So we're just gonna rotate this piece of tape so that that's on there. And do the same with the other side. Rotate the tape so that it sticks. You want to make sure this sticks on the side. I'm just going to put one more piece of tape just in case, so that we can make sure that that's taped down on there nicely, especially on this side, you know. There we go. Perfect. So now we want to make sure we tube down the or tape down the tubing. So we're going to do the same thing. We're going to take this piece of tape here, and we're going to do the butterfly technique again. And we're going to go ahead, again, we're going to lift the tube up. We're going to put this into the center right there. And then you're going to go ahead and do the butterfly technique. And you're just going to tape upwards like so. And there we go. And this is a tube right there. Again, you wouldn't do this on a real patient, but you can lift it up, move it around, make sure it's in there, and it's in there. And then you can just go ahead and remove your tourniquets, since we have now put both needles in, the arterial and venous needles. And that's it. That is how you cannulate an AVF, and that's all for today. Thank you so much.